All right, Emily, we're going to start off with an interview and figure out what's happening, and then an exam. Okay, we're very, very far away from the adjustment at this point. Okay, there's no reason to be nervous. And then when we get to the adjustment, I'm going to explain everything that I'm doing while I'm doing it. Okay. So if you have any questions or comments, you can shout them out before I adjust you. We'll practice it so you can see what it feels like. Okay. All right. All right, so let's talk about your back pain. What happened in February?
I don't know. I just bent over one day and I felt like, I don't know if it was pinching or rubbing or something in my lower back started like hurting. Okay. And now it would hurt when I was walking upstairs or even at some points just walking it would hurt. And then it'll go away and then I'll bend down again or pick something up and then I'll start again. Okay. So. Do you have pain every day? Yeah, just about. Sometimes it's worse than other days.
Have you ever had this pain before February?
No.
This is the first time you've had it?
Yeah.
Well, what's your activity level like now?
Like, I'm in marching band at school, but it's like our off season.
Okay.
And then I'm also in, like, our play, which isn't, sometimes it's a little more active than you think it would be, but
yeah, sure.
I don't play sport.
Okay.
So.
What? Marching is a sport?
Yeah.
What instrument do you play?
I play the mellophone.
The what?
The mellophone.
That's like one of those things with the mallets?
No, it's a French horn, but it's like a trumpet, but big, kind of.
What? That's awesome. Those horns are cool, especially when there's 20 of them all playing at the same time. You had any pain that goes down your legs at all in the past couple of weeks or since this happened?
I don't know. I think all my bones just feel like tight.
Okay.
They feel all crunched together.
Left side equally on the right?
Probably a little more on the right. Feels like tighter up in my hip here.
Okay. Good. No numbness or tingling in your feet?
Nope. I think I have an iron deficiency.
Why do you think that?
I also always crave red meat. All the time.
How often do you eat it?
I don't know. Not a lot.
Yeah. So do you notice that the cravings, do they change with your cycle?
Oh, wow, that's really bad for you. I don't know.
Tell me about it. Is it slow? Is it fast? Is it painful?
It's really fast and it's extremely painful. I'll often pass out or throw up or I have chronic migraines, so I'll take Mig relief. Sometimes it feels like my knee wiggles out of place, but
knee wiggles out of place. Okay.
Also my ankle, I can repeatedly crack it.
Okay. Have you ever been adjusted before by a chiropractor?
No.
Good. These are my favorite kinds of adjustments. The first adjustment ever, or the best. All right, so we're going to start off with an exam on your spine, and then we'll go through all the procedures. I'll explain what I'm doing. Go ahead.
One time my doctor said I have a slight curvature in my spine, just to let you know.
Okay. Very good. Thanks for letting me know. I appreciate it. Is there anything else I need to know?
I don't think so.
All the videos are like this?
No, not at all. No.
Okay.
No, this is new. Yeah. Not very stiff here. Do you stretch at all?
No.
This part of your back right here, this is marching posture is what this is. This is that extreme posture. Marching is tough. I know a couple people are marching and just the impact from all the steps over and over again with the instrument in your hand.
And then having your horn angle, you almost have to arch your back backwards.
That's exactly what this feels like. All right, when did this doctor tell you that you had a
probably
slight curvature?
9th or 10th grade.
Yeah. There's a little bit of a rotation here in the thoracic lumbar where you're just kind of rotated like that down here, not up here.
Okay.
But that might be what he's talking about. We're going to look a little bit closer. I'm going to push into your SI joints here. Do you have any tenderness here?
Kind of hurts, I
here.
guess. Yeah.
Here, here. Same on both sides. Does that that's tender though, not ticklish?
No, it's just uncomfortable, I guess.
All right, I'm gonna place my fingers on the iliac crest up here. Okay. Okay, that looks pretty even. Scooch up to the front of the table just a little bit. All right, bring your feet together on the ground, and then what you're gonna do is move your knees further apart from each other. Good. Okay, now bring them back together. Good, open, close, open, good, close. A little bit of restriction on the right SI joint. They're both tender though. Let's look into the lumbar. Let's do this. Go and turn to the left. No, hold on. Keep your knees straight and just turn your upper body. Any discomfort, tenderness there?
No.
Good bouncing, good wiggling, very good range of motion in those segments. Turn to the right now. Good. Not so. Does this feel different? It is a little bit more stuck on that side. Okay, face straight forward. That's good. Oh, the tone here is nice and even all the way through, except for this one area. There's just a little bit of a rotation. But other than that, it's straight up and down with no curvatures to the left or right. So let's do this. Go ahead and stand up. Let's check for a curvature a little bit more in depthly. Okay. Now bend forward and touch your toes. Okay, looking at the spine. Nice and straight. No rib humping. Again, just maybe a slight rotation. Go ahead and stand back up. But no curvatures. Just a slight rotation, which is a postural thing and normal, so you can forget about what that doctor told you, okay? All right, so what we're gonna do is go ahead and put your shirt back on.
Okay.
And then let me know when you're ready. Ready? Here's the shot. The shot is the card handoff to Aaron. Take one.
He said he'll make you do this all night.
We're just gonna do this until however long it takes, okay? Did you hear what he said?
No.
That was good. Here, let's do a non-catch one this time. I want to make it land.
Oh, did he say dude thing?
Yeah, he just said this is a total dude perfect shout out.
Alright, you're doing the non-catch.
No, that was terrible. Too much risk. So we tone it down a little bit.
I heard that.
Okay, ready? Take 5. Take 6. Oh, way too much. That was a good rebound though. Just going into the next patient like nothing ever happened. Normal. Take 7. Ah, so close. All right, stand on the mat, face me over here. All right, good. Now let your shoulders relax. Okay, I'm gonna look at your arches first. I'm gonna touch your feet. We have a collapsed arch both sides. It's from March. It's from marching for sure. You're gonna get some orthotics and some arch support for sure. A little bit of high left shoulder. Okay, go ahead and march in place. Let me see the arms and everything. Let me see the march. Come on, you're the marcher.
I don't march like this.
Yeah, a little bit of external rotation. Let me see the horn. Hold the horn while you march. Oh, it's one of those. Okay. A little bit of external rotation on the right hip. Decreased arches bilateral. Okay, that's good. Now let your arms down. Higher shoulder on the left. All right, stand up nice and tall. Okay, I'm observing the micro sways in your posture right now, so just kind of stand there. Do you feel yourself? Kind of feel that a little bit? Okay, that's a lateral shift there. Category 2. All right, let your shoulders relax. Okay, I'm going to straighten you on the table now, okay? Okay, I'm just going to start with my hands, all right? We're just going to do some exam stuff. We're still very far away from the adjustment. All right. Okay, I'm going to straighten you out here on the table a little bit to the left, right? Good. Now, looking at your legs, let your legs relax. Let this go. I'm going to take your socks down just a little bit, okay? All right, looking at your ankles, they're very close to even, just slightly shorter on the right. I'm going to bend your knees. Okay. Try not to help me, okay? Let me do it. Perfect. Good job. Right short. Right short. Stays short. Okay, we're going to test that out a little bit. I'm going to push down into your pelvis, okay? Okay. Okay, this is your right SI joint. Any pain there? No. No, but that was a big clunk there. Did you feel that? No. No? Do you ever feel like this clicks by itself?
Sometimes.
Okay. I'm going to push into the left SI joint. Any pain there?
Oh, no, but I do feel that.
Where? Where my hand is or somewhere else?
No, where your hand was.
Okay. This side?
It feels different. I just don't know how to.
Okay. I'm going to push into your lumbar. Do you feel that right there? Yeah. L4 there? Mm-hmm. L3 here? Mm-hmm. Okay. All right, I'm going to push to the left and the right. Do you tell which side is more tender or same?
The left side.
Left lumbar. I'm going to test your lumbar spine. So what you're going to do is keep your knee straight. Mm-hmm. Lift your entire leg in the air. Okay. Okay, do the right leg first. Okay, that's good. Down. Let your back relax. Left leg. Down. One side easier than the other?
Yeah.
Which one?
My right side.
I'll put some blocks underneath of your hip. Okay. No, just relax. Let me do it. Okay. I'm going to do the right side first, like this. Good. Down. Okay, let me do it. I'm going to pick you up. Good. Down. Good. Okay. What feels weird?
Yeah.
Yeah, they're a little bit off. All right, I'm going to just let those sink in for a little bit. All you have to do is breathe. We're going to check out the rest of your spine. Tender?
Mhm.
Tender?
Mhm.
Left or right? Which one more?
Yeah,
Or same.
yeah, I guess the same. Maybe a bit.
Tender or ticklish?
Tender.
Very tight though. Do you guys stretch and warm up before you march or what?
Yeah.
This is so tight. That pot, you've easily put in thousands of hours holding that horn upright. How old are you? 2003. You're a senior now. So you've been doing it for 4 years?
Actually, only 3.
Okay. Very stiff. Good. Okay, let your shoulders relax a little bit. I'm just going to push into your spine, not adjusting yet, just feeling how your spine is moving. Okay. All right, I'm going to push down into your sacrum again. We're going to test the blocks. Okay, I'm going to push back into the left SI where you had pain. Do you still feel that pain there?
No.
Okay, I'm going to push into your lumbar. Do you still have the pain here?
No.
Your right leg came up a little bit short, and then when I put the blocks underneath of it, it balanced out, and then it took the tension out of your pelvis. So that tells me that you don't really have a short leg. You just have like a twist in your hips, and then I untwisted it with the blocks, okay? Everyone has a twist, by the way. It's just a normal human being thing. You don't have to go home and Google anything, or you don't have any weird conditions. All right, this is the instrument. How's that pressure, okay? Okay, I'm going to go a little bit harder. Tender, ticklish? Tender?
Yeah.
Okay. Just breathing. Just let yourself sink into the table. Good, still good? All right, good. This helps loosen everything up and it gets it ready for the adjustment. Also, right now, your pelvis is in the correct position with the blocks. And the instrument is stimulating something called proprioception. That's like your body's awareness of itself. It's the same thing. It's internal syntax of your body. So like, you know that your palms are pointed down right now, not because you're looking at them, but because of the proprioceptive nerves in your wrists that are communicating that information to your brain. Are you familiar with this? Did you take an A&P class?
I took anatomy.
Yeah, Good. And you recalled it? Ooh, we got a future doctor here or what?
No.
No?
No, I want to be a math teacher.
You want to be a math teacher?
Yeah.
That's so heroic of you. You're a brave person.
I know.
What level math do you want to teach?
High school.
What's that?
High school.
High school math? Algebra?
Yeah. I like statistics and geometry.
Oh, okay, cool. Well, I mean, it's all cool. Not just that's cool. Of course, that sounds more interesting to me. But only because I blocked all the high school algebra out of my mind. That's cool. You know what? Teaching is just it's like the noble profession that is the unsung hero of all professions.
I agree.
How could it not be the most important thing that we do? Teaching children.
Yeah, I wanted to be an elementary school teacher. And then I did an internship at our elementary school.
And you were like, no way.
It. Oh my goodness. It's awful.
It's different though. It's different dealing with kids and kids listen to teachers more than they listen to students or listen to their parents for whatever reason. You know, do you ever get any bad reports about Emily from her teachers?
No, she's a really good student.
Yeah, exactly. Is it the same Emily at home? Is her room always clean?
No.
Exactly. What is that? Why do we do that?
I don't know.
Yeah. There's got to be an equation for it. Have you ever done any quantum physics equations?
No.
I don't recommend it. All right, I found a couple things to adjust here today.
Okay.
Now, there's some stiffness in here, but it's mostly just postural stuff, okay? It's not like it's not like that there's anything in here that you can't fix on your own with just simple stretching, okay? And you're probably almost done, right? Are you going to continue, do you think, marching in college?
Yeah.
You're going to keep going for it?
Yeah.
Well, then you really have to start stretching. It's really going to be really important, Emily, if you want to do it pain-free. All right, so this feels like a very simple, straightforward sprain strain of your spine. I'm going to adjust your SI joint on the right and your lumbar L5 on the left.
Okay.
And that should take care of a lot of this tension that you've had from this injury and help you heal faster, okay?
Okay. Oh, I'm so scared.
Okay, it's okay. You don't have to be scared. I mean, it's okay to be scared. Let's practice one first so you can feel it, okay?
Okay.
All right, so let your shoulders sink in, and you're going to breathe in through your nose and out through your mouth. Good, I'm going to follow your breath down like this, and then at the end of your breath, we give a push like that, okay?
Okay.
All right, we're going to start in the middle of the spine. This is the easiest one to push. I'm not going to push hard. We're just going to go very gentle, okay? Okay, nice and gentle. Deep breath in through your nose. Good, and out through your mouth. Good, I'm following your breath. Gentle. How's that? Pressure's good?
Yeah.
That's good. Yeah. That's cool. Laugh it out. Get it out.
I'm gonna have fun.
I know you're fine. I'm just allowing you the space to express whatever it is that you need to express. You weren't expecting that. What were you expecting? Okay, this is going to be very gentle. I'm just going to follow your breath, and then we're going to push from right about there this time, okay? Okay, let's try that again. I'm going to deep breath in. Good, and out. Good, let the shoulders sink, shoulders sink, shoulders sink. Wow. How was that? Intense or what?
Yeah.
Okay, just rechecking, making sure it all went good. All right, so this one's a little bit different. This time we're going to push at the top of the in-breath. So you're going to take a deep breath in, and then at the bottom of your, or as you start to breathe out, then we're going to push, okay, at the top of your breath. So let's try that. Take a deep breath in. Good, and then as you breathe out, good, at the top of your breath is where we'll push, okay? All right, so let's try that. Deep breath in. Good, and out, let it out. Very good. Feel how that one was a little bit stiffer though? Mm-hmm. That's it right there. That's what we need to work on. I'm going to show you how to work on this. Very simple stretching, okay?
Okay.
You're going to bend the top leg.
Okay.
Good, just like that. All right, I'm going to scoot you forward to the end of the table here. We're going to pull this shoulder out just a little bit like this.
Okay.
Okay, you're facing in the right direction, Emily, just like that. And then your hands go right here. Okay, so what you're going to do is just like the other adjustments. You're going to breathe, and as you breathe out, your shoulders are going to move this way. I'm going to bring your hip down like that, and then right from there, we're going to push, okay?
Oh, okay.
Okay, I'm going to pull you forward just a little bit more. Head back. Good, same thing. Breathing in.
Okay.
Good, and out. Good, let the shoulders come up like this. Good, we're going to bring the hip down. Oh. Yeah. That needed to happen, right?
Yeah.
You can't. Okay, same thing here. Breathing in.
Okay.
Good, and out. Good, let your shoulders come up like this. Bring your hip down. Good. Lay on your back. Good stuff, right? Mm-hmm. Now we look at the neck. All right, let your legs relax, hips relax. Okay, turn your head to the right. Back to center. Turn your head to the left. Back to center. One more time to the right. Center. Okay, bring your right ear down to your shoulder. And center. You have a lefty neck. You're right-handed though, right? Mm-hmm. Yeah, you have a lefty neck though. Yeah. It is a thing. I made it up, but it's a thing. It's actually the sign of an artist, I find. The lefty neck is the true artist. See? It's accurate. What's your art? You paint? You draw?
I'm in senior art, so I do all of it.
Senior art, like old people? Like the elderly? Geriatric?
Sure, you know what? We can call it that.
Geriatric oil paintings.
Right
They
now.
hold still. They can't move fast. Tender?
Yeah.
How about this side?
Not as tender, but it's still tender.
Okay, we're just going to do a little bit of traction here to start loosening up your spine.
I'm painting a 3 foot by 6 foot mural right now.
Cool. What is it?
It's like a sunrise set thing. I don't know.
Which one is it? Sunrise, sunset?
I don't know. It's
What
just
planet
the
are we
sun.
on here? Is it orange or gold?
It's orange.
Oh, it's sunset. What is it setting over? Trees, mountains, ocean?
These little rolling hills.
Oh, rolling hills. Where'd you guys drive from?
Near Reading.
Oh, okay. So that's not a bad drive. So what's your inspiration out there? There's driving from
farms.
Reading to here is the farms, yeah.
Yeah.
I'm gonna start on the left side. Is this a PQRS wave there on your neck?
It's the sound waves of laughter.
Oh my god. That's so cool. All right, I'm gonna adjust your neck. We're gonna do the left side first.
Okay.
Dad, can you do me a favor? Can you move towards Josh there? My feet are gonna go right there. All right, so the adjustment happens like this, okay, Emily? Just like the other adjustment, it's gonna be soft. Go ahead, let your head drop. Okay, I'm following your breath. Go and breathe in. We're just practicing. I'm not doing it yet. Breathe in. Good, and out. Good, I'm gonna follow your breath, and then at the end of your breath, we just push from right there, okay?
Okay.
All right, but let your head relax. Good. Good, let your head drop in. Let your shoulders drop loosey-goosey there. Good, now breathe in. Good. And out. Good. Let your head drop into my hand here. No, don't push it. It's okay. You're good. You're good. It's okay. You don't have to push it. Ready? Here's the feeling.
Okay.
You're just going to let it drop like that.
Okay.
Okay, ready? I'm going to hold it like this. I'm going to do this, and then that's it right there. Okay, you got it. Okay, breathe in and out. Good. Let your head relax. Shoulders. Okay, that was good. That was good. We almost got all of it. There's a little bit more though, okay?
Okay.
All right, same thing. Let your shoulders drop and let this kind of sink in. Okay.
Oh, that feels good.
Okay, that was good. It's okay, Mom. It does feel good, Mom.
She like freaking out.
I know, I can tell. It's not manhandling, it's so gentle. It has nothing to do with gender. I'm just very gently. I could be anything. I'm totally ambiguous. That's why I go like this. That's why I go nice and gentle, just so you can hit both frequencies on the spectrum of sound. Whichever one makes you comfortable, I'll be that one. Okay, ready? Sound of laughter? Okay, sinking in. Let this relax here. Good. Good. Breathe. Good. Just testing first. 7, 6, 5, 4, 3, 2. This is all 3, 4 right there. Okay, let this relax. Loosey-goosey here. Let your shoulders relax. Let me do it.
Oh, wow.
Sounded like my grandmother. Like I was telling her something she didn't understand about the internet. Oh, wow. That's interesting. I was just kidding. My grandma's dead.
Oh.
I'm going to crack your toes now, okay? You going to be able to handle that or what?
Gosh.
Should we skip this part or
I
what?
don't know. My friend always tries to do.
What a good friend.
It freaks me out.
Are they a math teacher too?
No. She's a gymnast, though, so she, like...
Oh, Taylor?
Yeah.
All right, I'm going to adjust your ankle now, so let your feet relax here, and then I'm going to pull in this direction like that, okay?
Okay.
Okay, let this go, let this go, let this go, let this go, let's go. Almost. Let's try this one here. Good. Good. Tight. That's a calcaneus adjustment, the heel bone. Hey, what's your job? What do you do?
I'm a hostess on a restaurant.
Okay. Well, at least you have shoe options there.
Yeah.
You can wear some supportive shoes.
Oh, yeah.
I'm going to write down the name of an orthotic company. They make custom inserts, and then you guys can go on the website and find the person near you who does those orthotics, okay?
Oh, nice.
They're not like weird shoes for your seniors in your art classes.
No, the clownier the better.
They just slip right into your shoes,
Okay,
leather tops, they last for years. High quality product, foot levelers, I recommend them highly. Okay, let it go, let it go. This right ankle is the snapping ankle.
Yeah, it's my right one.
Okay, that snapping repetitively is just this tendon comes snapping over the bone, okay?
Oh.
It's not like a joint cracking.
Right.
Okay, let go. Here, wiggle the toes on this left foot. Here, wiggle your left foot toes. Just the big toe. Wiggle just the big toe. Okay, stop wiggling. Stop wiggling. Good. Let go. You're really protective over the feet. All right. All right, so let's do this. We're going to do a sit up here. Good. Swing your legs off to the left. All right, jump up on this table over here now. Okay, relax there. Good. Oh, that was a bonus. Okay, this is a full spine adjustment, okay, Emily?
Oh gosh, okay.
All right, your arms are great where they are, and all you have to do is keep your teeth together.
Okay.
Okay? Okay, you just relax. It's okay. This is just like the other adjustments.
I think I've seen this before.
She knows. Okay. It's not like the other adjustments. It's not. Okay. All right, so I'm going to support your cervical spine with the towel like this, okay?
Okay.
Okay, and I'm going to follow your breath, and we're going to pull in that direction like that. This is what it feels like, okay? Okay, all you have to do is breathe.
Mm-hmm.
Keep your teeth together.
Okay.
Good, you can close your eyes. Nothing to look at out here. Good, you can close them.
Oh.
Okay, breathe in. Now just feel the traction. I won't pull yet. Feel it. Breathe out. This is what it feels like. Not bad, right?
Yeah.
Okay, let's do another one of those.
Okay.
Deep breath in and out. Good. Following your breath. That was so good. I know, the eyes, they were so big. Okay, squeeze your shoulder blades back together. Just a little bit of a lean in this direction, but we're going to straighten your head back up like this. Pull your chin in, look up at the ceiling. Any pain there? Good?
Oh, yeah.
Good. You're doing good. Almost there. Hold on. Okay, relax. Bring your head back. All right, so we're going to start off with the organs of digestion. Okay, so this is why I'm doing this.
Okay.
So you had an intestinal infection in the 7th grade.
Yeah.
And then periods started in the 8th, migraines in the 9th.
Mm-hmm.
Okay, so there's no correlation. It doesn't sound like there's a correlation
Right.
between your hormones and these migraines. Maybe, but then when you do have a migraine, even though it's a symptom of migraines, commonly to have nausea, you're having nausea, you're having throwing up. So how much of this migraine is actually occurring in your stomach is my question. All right, so we're going to start off with the ileocecal valve. Okay, this is the window between the large. Do you remember what the ileocecal valve is? It's a tough one. This is really obscure. You don't get this in the AP one.
Oh, no.
It's the window between the large and the small intestine.
Oh,
So where the
okay.
small intestine
Yes.
passes into the colon, okay?
Mhm.
Okay, so this is how we find it. First, I'm going to put my fingers on your belly button. Actually, why don't you
Okay.
show me where your belly button is? Okay, we'll start with that. Okay, all right, here, you put your hand on my hand so you can feel what I'm doing, okay?
Okay.
Are you ticklish?
Yeah.
All right, so now the next landmark is the ASIS here, the front of the hip, there, and then we're going to connect these 2 points and then find in the middle. Somewhere in here, we're going to start to look for the ileocecal valve. Things are moving.
Uh-huh.
That means you ate like 3 to 4 hours ago.
Yeah, probably. I can't see my
Is there a watch there or what?
There was. It's under my
This is a
sleeve.
fake out. Yeah. How's this feel? Is this tender?
Yeah.
Yeah. All right, so this is here. Bend your knees. So here's what I want you to do. I want you to put your fingers on that. And I want you to find that tenderness and then just do like clockwise circles on it.
Okay.
All right, this is and now from here, breathe into your belly. Breathe into your belly. Good, and out. Good. Good belly breath. So you've done this before,
I'm
right?
a singer.
Cool. Okay, another deep breath in. So next time you get a migraine, when it starts, this is what I want you to do. I want you to find this quiet spot, dark spot, lay down, and then start massaging your ileocecal valve here. Okay. It's very active. It's not happy. I can tell all around it. It's not happy. And maybe even some tenderness in like the appendix area. But this is a good place to start for trying to relieve your migraines. All right, so the next sphincter is the pyloric sphincter. This is where the stomach empties into the small intestine and duodenum. Is this tender at all?
Yeah.
Good. It doesn't feel as much to me. This is okay. This is happy, but you're feeling tenderness too. So I'm wondering if there's general tenderness. So here's what we're going to do. We'll go back to the ileocecal valve. Right now we're going to start at the ascending colon. This is the part of the colon that travels upward. Is this tender?
Yeah.
Okay, the transverse colon coming across the midline. Is this tender? And then down the descending colon. Still tender here?
No, the side wasn't that tender.
Not as tender on the descending. Okay. All right. Ready? Go ahead and where are the two landmarks for your ileocecal valve?
Oh, they're my belly button and then right here.
Connect the two. Good.
Right here?
Right, clockwise circles with belly breathing.
Okay.
So you want to like breathe into like your fingertips pushing.
Okay.
Okay, and that breathing, you know, you're a singer, the diaphragm moves.
Yeah.
It increases gastric motility as well and helps move things along, and also helps your heart beat at a more efficient rate.
Okay.
So try this. If it's gonna work, it's gonna work right away. I mean, you'll sit down with a migraine, you'll do this, you'll feel the relief, and then you'll know that this may be contributing to that.
Okay.
Okay. All right, good adjustment. Everything that we needed to go went perfectly. I think this stuff down here in your right SI should probably be better within a week, maybe 2 tops. And then and I'm excited to see what happens with the migraines. So next time you get a migraine, sit down and do it. If you feel like it's helpful or not, call the office, let us know.
All right.
And then we can try to go deeper with it if not. Okay. All right. Okay, is there anything else that you want me to look at, work on, talk about? Any questions, comments, concerns?
Oh, what stretches should I do?
Okay, great question. And then you're going to just open it up like this.
Okay.
To each side,
Okay.
right? You're gonna make a T with your arms and look away from your legs. I'll write down the name of it, and you can look up on YouTube. There's probably 100,000 videos. Okay, but really time it. Really want you to time it. So go to one side just for like 5 to 10 seconds. Other side 5 to 10 seconds. Then go to the next side, but do it 30 seconds. 30 seconds next side. Then do it a full minute on each side.
Okay.
All right, that's what you need.
Thank you.
All right, Emily, you're good.
Thank you.
All right, Dad, you're up.